Hello, everyone, and welcome to our question lab. This evening, we will be covering cardiac pharmacology, and we're happy to have all of you here. Leading today's dissection is Paras Fakaria. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident at UT Southwestern in Dallas, Texas. I originally graduated from pharmacy school in St. Louis, Missouri, and then went back home to Michigan to do medical school. And now I've been working with USMLE-Rx for about a year now, working as an RX coach. So working one-on-one with students in regards to USMLE Step 1 and Step 2 CK. And I'm happy to lead today's session today.
Excellent. As always, we're always happy to have Paras with us today. If you look at your GoToWebinar control panel, you'll see a question box, and that question box is there for you guys to ask us questions, and we have some wonderful panelists that will do their best to try to answer all of your questions. We have Kate and Jeff, who you'll meet later. And Kasha, do you want to introduce yourself?
Certainly. Thanks, Sean. My name is Kasha Bornstein. I'm a fourth-year MD MPH student at the University of Miami. Very excited that I just today applied for residency. I've been with Scholar RX and Coach RX for just about 7 months now, and mostly working with students on Step 1, Step 2, some basic science content to help people achieve their dreams. Very excited to be on the panel tonight.
Excellent. Thank you, Kasha, and we're happy to have all of our wonderful panels here as well. My name is Sean. I've been with RX Coach for going on almost 2 years now. And RX Coach is our new tutoring program, and Paras and Kasha are two of our wonderful coaches. We'll talk more about that here a little bit later this evening. All right, and with that, we're going to go ahead and get started with our first question of the evening. The methodology we're using today is the same methodology that we use in RX Coach, and we'll talk more about that a little bit later. RX Coach is our new one-on-one coaching and tutoring program. We've helped a lot of students, and you'll see some testimonials here later as well. So, question 1. So as you guys can see here, the answer choices are missing, and that is by design. The first step of our process when it comes to question dissections is to cover up your answer choices. I've removed those for you already. And the reason we do that is because we do not want these answer choices to dictate or guide your thought process. We also don't want you guys to see an answer choice that you're unfamiliar with that may cause you to panic as you're trying to answer this question. So I've gone ahead and removed those. And once we cover up those answer choices, we're going to read the lead-in. The lead-in is the last sentence for the question itself. So let's do that now. Which of the following drug combinations most likely represents drugs X and drug Y? Which of the following drug combinations likely represents drug X and drug Y? Now, once we read the lead-in, we like to ask our students 2 questions. The first question is, how many steps does this question require? An example of a 1-step question is where they ask you for the diagnosis. An example of a 2-step question is when you're asked for the treatment for a diagnosis. And an example of a 3-step question is when they ask you what is the mechanism of action for a treatment for a diagnosis. After that, we ask you what are the most important words in the lead-in. So if you guys want to take a second now and let us know what the keywords in this lead-in are in that question box, we'll go over those keywords, or rather Paras will go over those keywords here in a little bit. So once we do that, and keep in mind, the reason why we're asking you how many steps it requires is because it's important to have an organized thought process. That makes sure that you're not missing any steps on test day and that you're answering the right question, because sometimes if it's a 3-step question, the answer to the 2nd step may also be on that list, and we don't want you to answer the wrong question because you're nervous on test day, okay? So once we do that, we'll actually read that question stem together. In our coaching program with our in our individual sessions, the coach will stop you after every sentence and ask you what's important, what are you thinking, what's on your list of differentials, so we can not only make sure you're on the right track, but also start to pinpoint your strengths and weaknesses. We can't do that with you individually today, so I will pause briefly after every second and let you gather your thoughts. I know it's been a second since we read the lead-in, so let's go ahead and do that one more time. Which of the following drug combinations most likely represents drug X and drug Y? And now the vignette. An experimental assessment of the effects of vasoactive drugs is conducted on a cohort of healthy young men between the ages of 23 and 32. The results for drugs X and Y are as follows. After the administration of a high dose of drug X, the mean arterial pressure increases. After the effect of drug X has worn off completely, drug Y is added, resulting in a slight decrease in mean arterial pressure. When drug X is then re-administered, the blood pressure drops even more. Which of the following drug combinations most likely represents drugs X and drug Y? So I'm going to give you guys a second. I want you to think about what are the most important keywords in that question stem and let us know in our question box. And with that, I'll hand it off to Dr. Beccaria.
Thank you, Sean. So we'll go ahead and take a look at what we had thought were the important clues in this question. So when we look at that question itself, drug combination, so it's getting at, a combination of drugs, drugs X and drug Y, so which is most likely represented. And then when looking at the actual question stem, we're talking about vasoactive drugs in healthy individuals. And then we have a few clues. A high dose of drug X leads to something, an increase in mean arterial pressure. Drug Y, after drug X has worn off, leads to a decrease in that. And then drug X leads to, in the setting of drug Y, leads to a blood pressure drop even more. So when we talk about how many steps this question could be, this is a little tougher to classify. This is a little bit more of like a jigsaw puzzle, trying to see how you can get everything to fit. But at least I would say a 3-step question, because we have 3 individual clues there that we can use to help come to what we think is a combination. So let's go ahead and take a look at the answer choices and see what our potential answer choices are for this question. So we'll go ahead and start at the bottom with answer choice E, and we'll work our way up towards answer choice A. So the reason we like to do this is because a lot of times students will start at the top, answer choice A, and then they'll see something that they like, and then they'll select that answer choice without reading through all the answer choices. So by starting at the bottom and working our way up, this ensures that we read all of the answer choices and we're not biased by any one answer choice. So we'll go ahead and do that now. E, phenylephrine phenoxybenzamine. D, phenylephrine metoprolol. C, norepinephrine propranolol. B, isoproterenol clonidine. And A, epinephrine phenoxybenzamine. So we'll go ahead and open up that poll. Go ahead and gather your thoughts and select the answer choice that you think is the correct answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paras. So I saw a lot of you guys were on the right track with the keywords. That's great. So I'll give you guys a couple of seconds here to select your answer choice. Remember that on test day, there is no penalty for guessing. So if you're absolutely stuck, just take your best guess. And if for some reason tonight you're a little confused or maybe unsure about the answer choice, take your best guess, and we will go over the correct and incorrect answer choices here in just a little bit. So the answer choices are coming in. We'll give you guys a few more seconds. As you guys know, cardiac pharm is a very important topic, not only for the exam, but also in practice. So it's a category of drugs you definitely want to be familiar with, and hopefully you'll have a solid, more solid understanding after tonight's session. All right, and let's see what you guys selected. So in first place with 34% of you guys thinking the answer was A, epinephrine and phenoxybenzamine. And in second place with 22% was norepi and propranolol. So with that, let's see what the correct answer is. And the correct answer is A, epinephrine and phenoxybenzamine. And 34% of you guys got it right, so well done to those of you who got it. But let's make sure you got it right for the right reasons. And for those of you who didn't, don't worry. Paras is going to explain it to you now.
Thank you, Sean. Great job, guys. This is definitely a tough question, definitely a lot going on here. So we have an experiment, and they gave us those 3 things about what happens when you give drug X, what happens when you give just drug Y, and what happens when you give drug X in the setting of drug Y. Okay, So the most important thing here is knowing what each of those compounds or substances do and what receptors they act on. So that's the most important thing, basic pharmacology with those substances. So let's talk about epinephrine. Epinephrine stimulates both alpha and beta receptors. And actually, let's go ahead and take a look at the next slide. And there we actually have a table pulled up that shows that epinephrine works at beta and alpha receptors. However, you can see that there's a slight preference for beta receptors, although it does still strongly stimulate alpha receptors. Okay, so we know that beta-1 receptors are on the heart, and that causes increased contractility and vasodilation. So what about blood vessels? So when blood vessels, we're talking about beta-2 receptors and alpha-1 receptors. Beta-2 receptors, stimulation of beta-2 receptors would lead to vasodilation, while alpha-1 stimulation would lead to vasoconstriction. Okay, so small doses of epinephrine can cause vasodilation via stimulation of beta-2 receptors. However, at higher doses, you can see there that second line in that table, alpha effects predominate at high doses. So in this question, if you notice, they actually told us that they were giving a high dose of drug X. And if on that that first clue, a high dose of drug X is what they said. So at high doses of epinephrine, we have more alpha-1 effects. So we're going to get more vasoconstriction via alpha-1 mediated vasoconstriction. So thus, if you were to give epinephrine at a high dose, that would make sense that the mean arterial pressure would increase. Okay. Now, how does phenoxybenzamine fit into this? Well, that is a non-selective and irreversible alpha blocker or alpha antagonist. So if you give this alone after the effects of epinephrine have worn off, that would block any alpha-1 vasoconstriction. And thus, you would have lowering of BP because all your alpha-1 receptors are blocked, and the only thing that could possibly be stimulated within the body is a beta-2 receptor on the blood vessels. You would have a little decrease in mean arterial pressure. So now, if we give epinephrine in the setting of phenoxybenzamine, what would happen? Well, phenoxybenzamine would still be blocking those alpha-1 receptors. So the only thing available for epinephrine to bind to would be beta-1 and beta-2. Now, we know beta-1 stimulation would have increased heart rate and increased contractility, etc. But because when we're talking about the blood vessels, because those alpha-1 receptors are blocked by phenoxybenzamine, epinephrine can really only bind to the beta-2 receptors on the blood vessels, and that would lead to more vasodilation and thus a further decrease in blood pressure. So that is how epinephrine and phenoxybenzamine in combination lead to that clinical situation. So let's talk about why the other answer choices are incorrect. Answer choice E, phenylephrine and phenoxybenzamine. Phenylephrine is an alpha-1 agonist, so that would increase blood pressure through alpha-1 mediated vasoconstriction. Phenoxybenzamine is, like we mentioned, a non-selective alpha blocker, so that would decrease blood pressure alone. However, re-adding phenylephrine in the setting of phenoxybenzamine would not decrease the blood pressure. It would either be unchanged or eventually would increase again. So that's incorrect. D, phenylephrine and metoprolol. So again, phenylephrine is an alpha-1 agonist that would increase blood pressure. Metoprolol is a beta-1 blocker, so that would lower blood pressure alone, so that fits. However, giving phenylephrine in the setting of metoprolol would cause an increase in blood pressure because those alpha-1 receptors are not being blocked and phenylephrine can stimulate them. So that would be incorrect. C, which I believe was the second highly selected answer choice. So norepinephrine is an agonist mainly at alpha receptors, but it also has some beta-1 activity. So you would have an increase in vasoconstriction and blood pressure by itself. Propranolol is a non-specific beta blocker, and like the previous answer choice D, would just block beta receptors. So if you were to give norepinephrine in the setting of a beta blocker, you would not be blocking those alpha receptors, and you would have alpha receptor mediated vasoconstriction. So that is also incorrect. B, isoproterenol and clonidine. Isoproterenol is actually a agonist of beta receptors, so that would actually initially lead to a decrease in blood pressure since it would cause beta-2 mediated vasodilation. So that's incorrect right off the bat. So when we go to the next slide, you can actually see in first aid, they actually have this drawn out really nicely in a diagram, epinephrine before alpha blockade and after alpha blockade. So make sure to take a look at this diagram to understand what's going on in the presence of an alpha blocker, the absence and then the presence of an alpha blocker, to understand how that mean arterial pressure goes from being increased to decreased.
Excellent. Thank you, Paros. Definitely a challenging question. And I know a lot of you guys know these drugs, but may have forgotten how to think through them. And if you guys need help with that thought process to make sure you're able to apply your knowledge, please let us know. We'd be happy to help you. One of our coaches would be happy to help you. So with that, I'll give you guys a little trick, because a lot of people forget, which alpha 1 or alpha 2, beta 1, beta 2, which ones cause vasoconstriction, which ones cause vasodilation. The way I tell the students to remember it is pretty simple. You have a 1-lane road, you have a 2-lane road. I ask them which road is bigger. It's not a trick question. The 2-lane road is bigger, which means the 2-lane road has more room. More room is vasodilation. That's how I remember. Alpha 2, beta 2, 2-lane road, more room. So alpha 2, beta 2 cause vasodilation, while alpha 1, beta 1, 1-lane road, less room, cause vasoconstriction and increase your blood pressure. So keep that little trick in mind if you're having trouble remembering those receptors. And with that, let's go ahead and get into our second question of the evening. Once again, you guys will see that the answer choices are covered up, and we'll begin by reading the lead-in. Which of the following describes the effects of the new medication on cardiac function? Which of the following describes the effects of the new medication on cardiac function? And once again, I'll ask you guys, is this a 1-step question, a 2-step question, or a 3-step question? And what are the most important keywords in the lead-in? We'll give you guys a few seconds to submit your responses here in the question box, and then we'll get started. I see some people saying 2 steps, some people saying 3 steps, and of course, Paros will go over that with you guys in just a second. And now that we've read the lead-in, let's go ahead and read that vignette. A 65-year-old woman comes to the emergency department because of a 2-month history of worsening shortness of breath. The patient says she used to be able to walk 2 blocks without becoming short of breath, but now she has to stop to catch her breath after walking half a block on flat ground. At night, she uses 3 pillows to sleep, but denies any worsening dyspnea at night. The patient has a medical history of hypertension, diabetes, and congestive heart failure. She has been treated at home with an angiotensin converting enzyme or ACE inhibitor, beta blocker, and metformin. Her blood pressure is 105/72, her pulse is 107 per minute, and respiratory rate is 20 per minute. On physical examination, she has diffuse coarse breath sounds and 2+ pitting edema bilaterally in the lower extremities. After this patient's acute symptoms have been treated with furosemide, the physician decides to add a second drug that will further control her heart rate. She is counseled that this new medication may cause visual disturbances, as well as nausea, vomiting, and diarrhea. Which of the following describes the effects of the new medication on cardiac function? So I'll give you guys a few seconds here to think about the important clues and let us know what they are in the question box. I'll give you guys a few seconds to process that. I know it was a longer vignette. Then we'll turn it over to Paros to go over those clues and uncover those answer choices. All right, I hope your gears are churning here. And with that, let's go ahead and hand it back off to Paris. Paris.
Thank you, Sean. So we'll go ahead and show you guys what we thought were the important clues in this question. So when looking at the actual question, one, we had highlighted that effects as well as new medication and cardiac function. So on that next slide with the highlighting, I think that will show up there. And then in the vignette part of it, so obviously epidemiology is important. So 65-year-old woman, what are her symptoms? She has a 2-month history of shortness of breath. She can't walk as far anymore. She's using 3 pillows to sleep or pillow orthopnea. What are her past comorbidities? So we know she has heart failure. Okay. They told us what medications she's on. She's on an ACE inhibitor, a beta blocker, metformin. They gave us some vitals, pulse 107, respiratory rate 20. They gave us some important physical exam findings as well. And then importantly, they told us that this patient was acutely treated with furosemide, and then a second drug was added to further control her heart rate. This second drug may cause visual disturbances as well as nausea, vomiting, and diarrhea. So which of the following describes the effects of this new medication on cardiac function? So a couple things here. One, in terms of how many steps is this question, I think this is probably a 3-step question. I think one, we need to know from those clues, what could this new medication be? 2, what is the mechanism of action of this drug? And 3, how will that affect cardiac function? So probably a 3-step question. Now, another key thing here is you could have just looked at that last sentence of the vignette and gotten a lot of clues about what that medication was. So just keep in mind that by highlighting, you can get a lot of clues as to what's going on and then be able to answer these questions efficiently. So let's take a look at those answer choices. And again, we'll start at the bottom and work our way up. Answer choice E, increased ejection fraction and decreased vagal tone. D, increased ejection fraction and decreased heart rate. C, decreased end diastolic volume and increased natriuresis. B, decreased end diastolic volume and decreased afterload. And A, decreased end diastolic volume and a small decrease in afterload. So we'll go ahead and open up that poll. Go ahead and select the answer choice you think is the right answer, and we'll talk about it in just a few seconds.
Excellent. We'll give you guys a few seconds to respond. I love the enthusiasm in the audience, but remember, we asked you guys to input the most important clues, and we never asked you what drug it was. And this question isn't asking you what the drug is. So if you guys skip steps like that during the test, you're very likely to make a mistake. And I see that some of you guys got the right answer about the drug, but it's not what this question is asking. But some of you guys who jumped to answering what medication it was actually got the medication wrong also. So it's important to make sure you're not skipping those steps and that you're actually picking up on these clues, because this isn't a competition, right? On the test, all we want to do is compete with ourselves to get as many points as possible, okay? So make sure you guys are setting yourselves up for success on test day and not jumping too far ahead before you think about the question and the relevant clues. We'll give you guys a few more seconds here. Excellent. I see the answer choices coming in. A lot of you guys seem to be on the right track, so that's great. All right, a few more seconds here. Excellent. Well, let's see what you guys selected. And it looks like in first place with 38% of you guys selecting was answer choice D, which is increased ejection fraction and decreased heart rate. And in second place was E, increased ejection fraction and decreased vagal tone. So let's take a look and see what the correct answer is. And the correct answer is D, and 38% of you guys got it right. So well done. Increased ejection fraction and decreased heart rate. For those of you who guys follow us on Instagram, this was actually our Instagram question today. So make sure you guys are following us if you're not already. So with that, I will turn it back over to Paris.
Thank you, Sean. Yep, nice job here with this question, guys. Definitely a lot going on as we talked about a nice three-step question. So this patient, as you guys probably picked up on, was presenting with a heart failure exacerbation, pillow orthopnea, worsening dyspnea, pitting edema as well, fluid in the lungs. So they gave her a diuretic to get some of that fluid off. So then the physician elected to start a new drug, which has visual disturbances and GI symptoms as side effects. This drug, used in this setting with that side effect profile, must be digoxin. So let's take a look at that next slide. And we actually have a table pulled up looking at cardiac glycoside, specifically digoxin and how it acts. So digoxin directly inhibits the sodium-potassium ATPase. So this eventually downstream leads to increased intracellular calcium. So as you can imagine, that would lead to stronger contractions or positive inotropy. You also get stimulation of the vagus nerve, which we know is more parasympathetic, so you would have a decreased heart rate. So we know this patient will have a decreased heart rate, and we know there's increased contractility. Increased contractility means increased ejection fraction or decreased end systolic volume. So when we go back to the answer choices, we can see that answer choice D, an increased ejection fraction because of that nice pump in contractility, and as well as a decreased heart rate, that is the correct answer choice here. But let's talk about the other answer choices real quick as well. Answer choice E, I believe that was the second highest selected answer, and some of you may have gotten confused with the wording there, but you do have an increased ejection fraction like we mentioned, but you actually have an increased vagal tone or a decreased heart rate. So that might have been a little mix up in words with answer choice E. So make sure you're always looking out for things like that where they're trying to trip you up. Answer choice C, decreased end diastolic volume and increased natriuresis. And then let's also talk about answer choice A and B, where we're talking about afterload. So in this situation, we would be more so concerned with end systolic volume. So you would have a decreased end systolic volume, not necessarily decreased end diastolic volume. Furthermore, you shouldn't really see any effects on afterload, and this medication doesn't really have any effects on the urine output or natriuresis. This medication, as we showed, really only affects contractility and heart rate. So answer choice D would be your correct answer here.
Excellent. Thank you, Paris. Once again, this was a pretty challenging question, right? But you're going to have challenging questions the day of your exam. But more importantly, you're going to have challenging cases once you become a physician. So it's important that you're able to identify, all the clues, use your knowledge, and then apply that knowledge to get the answer correct. And if you guys are having trouble with that, we actually have a new program called RX Coach, and we can assist you. And if you look here, we've got two wonderful testimonials. We have a student that graduated in 2007, and after 4 weeks of tutoring, she passed step 1, okay? She was very happy with the strategy to go through questions, explanations, and tips with the study schedule and the approach to studying. And we also helped her stay motivated, right? So it is teamwork, and we helped her get across the finish line. We had another student, and look here, he analyzed my approach to questions on a deep level and provided proper resources for any knowledge weaknesses, as well as test-taking strategies to optimize my time spent on each question. And he went up 73 points. That's a pretty significant increase. So, let me ask you guys a question, and let us know how your studying is going. How would you describe the results you are seeing after your study sessions? A, I am seeing great results and I am happy. The results do not match my efforts. I'm plateauing, or I'm spending too much time and falling behind. Let us know. I'll give you guys a few seconds here to respond. Once again, we do have a raffle at the end of our lab today, so make sure you stick around because you must be present to win, and one of you will walk away with a very valuable prize. We also have a special offer we're going to share with you, so you guys can take advantage of that. Give you guys a few more seconds here. Please do give us a response here. I see the responses are coming in very slowly. So let's take a look. I'll give you guys just a few more seconds here, and then we'll move on to our third question. Remember, next week, Tuesday at 6 p.m., we'll be doing question dissections on public health sciences. And next month, we are planning on doing one at some point on a topic we haven't done yet, so stay tuned. I think a lot of you guys will find it helpful. All right, let's take a look and see how you guys did. Looks like only about half of you guys responded, but that's okay. And if you look here, 21% of you guys are seeing great results and you're happy. Wonderful. That's great. But a majority of you guys aren't really that satisfied with studying efforts. And that's okay. You're not alone. As you can see, that's the majority of the audience tonight. And a lot of students feel like, hey, it's just me. It's just me. It's not just you, as you can tell. But, I talked to a lot of students who are like, oh, my friend said to do this. Oh, I read this online. Well, your friends and you are different in the way that you learn differently, you think differently, and you apply what you know differently. You also have different learning styles and different ways of thinking. And so in order to really maximize your potential and study efficiently to make sure you're getting the results you want after you're studying and being efficient when you're studying and not wasting time, you can use an RX coach. And what we do is what we did with these students and hundreds of others, which is we work with you on a one-on-one basis to identify those strengths and weaknesses. And we do that by not only spending time with you, but also with the initial assessment that we give you. Once we have that assessment, we make a study plan. And once we make that study plan, we work with you to implement it. We work on knowledge and content. We work on test-taking skills and dissection skills. And then we also work on timing and stamina. So we really attack things from all angles. And we have a wonderful learning specialist who even help train our tutors and that we can use if needed. So it's a wonderful process. We've helped a lot of people. And if you're interested in receiving that one-on-one type of attention so you guys can maximize your score and get that residency you've always dreamed of, visit us online at rx-coach.com. That's rx-coach.com. And on the top, you'll see a free consultation tab. You can click on that free consultation tab to schedule a free consultation to talk about the program and how it can benefit you. If you want general advice on how to make a study plan and how to use our resources, that information can be found at firstaidteam.com. But if you're interested in tutoring, please visit us and schedule that free consultation so we can chat about the program and how it can benefit you on your path to 250. Speaking of path to 250, make sure you stay tuned. We'll talk a little bit later about our webinar with Dr. Lee coming up on October 26th. And with that, let's go ahead and get into our third question of the evening. Once again, the answer choices are covered up, and we will start with the lead-in. Which of the following is the most likely serious complication that can occur as a result of his long-term exposure? Once again, which of the following is the most likely serious complication that can occur as a result of his long-term exposure? Give you guys a few seconds to let us know in the question box what you think the most important clues are in the lead-in and how many steps you think this question will require. All right, I see you guys are responding. And of course, Paris will go over that with you guys here in just a second. Let's go ahead and read that lead in. A 46-year-old man comes to the clinic for an annual checkup, reporting headaches, dizziness, and palpitations. He works at an explosives factory and is concerned about long-term exposure to industrial chemicals. His physical examination is normal, and lab studies show a leukocyte count of 8,000, hematocrit of 46%, hemoglobin of 15, platelets of 310,000. He is found to have increased blood levels of an industrial agent. Which of the following is the most likely serious complication that can occur as a result of his long-term exposure? We'll give you guys a few seconds to let us know what you think the most important clues are in that vignette, and then we'll turn it back over to Paris. We'll give you guys a few seconds here. I see the responses coming in. Hope you guys are thinking about it. And with that, I'll turn it back over to Paris.
Thank you, Sean. So we'll go ahead and point out to you guys what we thought were the important clues in this sentence and lead-in. So when I read this question, I thought, 46-year-old man, obviously epidemiology and demographics. And what is he complaining of? He's saying he has headaches, dizziness, and palpitations. Anytime they give you some important demographic information like works at an explosive factory, I think, definitely want to keep that in the back of your mind. So definitely, something I would highlight ×3. And then, he's worried about exposure to industrial chemicals. When you take a look at his labs, that nothing really stands out, and that's because they actually are all relatively normal. They all are normal, actually, except for increased blood levels of an industrial agent. So in that lead-in, what is the most likely serious complication that can occur as a result of his long-term exposure? So, okay. So one, I think we need to figure out what is this long-term exposure, if there is any. And two, what could be a long-term serious complication that could result from that? So I think we have a two-step question here, maybe depending on what they're getting at with the answer choices, but I think this could be a two-step question. So we'll go ahead and take a look at those answer choices. Answer choice E, tuberculosis, D, dementia, C, congestive heart failure, B, cardiac ischemia, and A, anemia. So we'll go ahead and open up that poll again, and then go ahead and select the answer choice that you think is the correct answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paros. And I saw a lot of people, again, jumping to the drug. Some of you were correct. Some of you guys were incorrect. Once again, jumping steps like that is not going to do you any good. Remember, it's not a race. Just give you guys a few seconds here to respond. And remember, this is not asking you what drug this patient, it's not asking about which drug, it's asking you what the complications are of long-term exposure. So we'll give you guys a few more seconds here, and hopefully we'll come up to the right answer, and then we'll go over the correct and incorrect answer choices. Remember, when you're doing practice questions, it's important to make sure you got the question right for the right reason, and that you can explain why the incorrect answer choices are incorrect and why the correct answer choice is in fact the correct answer, okay? Give you guys a few more seconds here. All right, and let's see how you guys did. And it looks like we have a tie between B and C, cardiac ischemia and congestive heart failure. And then we have anemia behind that. So let's take a look and see what the correct answer is. And the correct answer is B, cardiac ischemia, and 31% of you guys got it right. And Paris is going to explain to us why that is the correct answer. Paris.
Thank you, Sean. Yeah, great job, guys. This definitely is a tough question. So this patient is presenting with headaches, dizziness, and palpitations. Okay. Now this patient works at an explosive factory. This is one of those fun questions where they like to ask you about, what is the patient being exposed to when they work at an explosive factory? And that would be nitrates. So let's take a look at the next slide, and we actually have a table pulled up looking at nitrates. So one of our takeaways from today will be nitrates is a risk factor in working at an explosives factory. So on that next slide, on that table in nitrates, it talks about a phenomenon called Monday disease in the adverse effects of nitrates. So Monday disease, what is that? Well, historically, patients who had this exposure, when they were getting constant exposure to nitrates at work, they would develop tolerance to it during the weekdays. So they're getting exposed to it, but during the weekdays, they're fine because they're getting exposed to it every day of the week. However, what happens is on the weekend, Saturday and Sunday, they're not getting exposed to it, so they lose that tolerance. So then what happens is on Monday, when they're re-exposed to that nitrate again for the first time in a couple days, they develop symptoms again. That's why it was historically called the Monday disease. As a result, you can get headache, you can get tachycardia, you can get dizziness, some of the other adverse effects listed in that table. Now, when we're talking about nitrates, keep in mind that when you have that going on, when you have acute vasodilation, what can end up happening is you can get compensatory vasoconstriction in critical areas like the coronary vessels. So that's why you can see that in certain conditions like right ventricular infarction, it is actually contraindicated. So you can actually get unopposed vasoconstriction in coronary vessels leading to consequent cardiac ischemia. So that's why answer choice B is a correct answer. The other answer choices don't really have anything to do with nitrates, so we won't go too much into those. But specifically, the main thing here is that this was a nitrate exposure, and that long-term exposure to that can lead to cardiac ischemia because of unopposed coronary vessel vasoconstriction.